Steve Shrubb, Director of the Mental Health Network, the NHS Confederation.
Steve, what do you see as the positive impact and opportunities rising from the Coalition's plans to reform the NHS and create a big society?
Well, I think perhaps the biggest opportunity is that this is all based on localism. This is based on the principle of giving local communities and local people more power. Very difficult to do, easy to say, very difficult to do. But there lies a huge opportunity if we can really get people involved so they've got more control over making decisions about things like health and social care, how the money's spent, what it's spent on.
What do you see as the potential negative impact to changes in services and reductions in local authority and NHS funding?
Well, I think we have to live in the real world, and the real world is in a financial recession, so it is inevitable. But there are two things that concern me. The first is that often when money is reduced, it's the most vulnerable that suffer the most. So I think we're all going to suffer, no matter who you are, we're all going to suffer. But I really do have a concern that the most vulnerable are going to suffer disproportionately. I think the second thing is that there is so much change going on at once. And I'm a great believer in change, never let a good crisis pass you by. But everybody has a capacity. There's only so much we can do. And I suppose I have a concern that we might just be changing too much all at the same time.
If you had the ability to ask a question of someone in power and or influence, who would it be and what would you ask them?
I think it would be anybody in the coalition government, and that is, can you hear me? Do you understand what I'm saying?